I think number two, and this could get to be a very complex discussion, but the bottom line of it is medical education as a barrier to entry, if you will. It's different now than it was, 30 years ago, but what we see is, while there might be a awareness of integrative therapies and approaches and things in medicine in general, the big medical system, unless it's something where maybe your hospital has a specialty clinic that's integrative medicine or something like that, there's nothing done about it because the doctors and my colleagues on, what I would call the, establishment side of medicine largely think that anything that they didn't learn about in their training must not be real, must not be scientific, etc. And so this prevailing thought process along all of medicine that if we're doing it in the big system, it's scientific and it's real and it should be paid for. If it's done anywhere else, it's not scientific, it's not real, etc. And there's a pretty big not only divide philosophically there, but also the underlying thought process is fairly prejudiced. For example, there are, you mentioned I've written a textbook and some other books, and I do a lot of other writing. In one book alone, just about integrative therapies for patients dealing with cancer, there's 1,100 references from peer-reviewed medical studies. So, there certainly is more science than people believe there is for a lot
Right.
of what's done. So I think that the medical education, that's the big first layer, is getting past the idea that it doesn't work and it's not scientific. The second layer, which I'm involved in a lot, teaching continuing medical education, is while we certainly have more and more healthcare providers interested in learning about integrative therapies and things like that, if you go to your average primary care general practitioner, et cetera, they're so busy, they're probably not, involved in learning about those things. So it's not that they maybe would have to do these things for you, but they wouldn't even know where to refer you. So it's sort of the medical system and the education and, the prejudices work against you. So that's number two.